Every normal heart has a normal rhythm. That rhythm varies from person to person, but in most healthy people, the heart at rest beats about 60 to 100 times per minute. Arrhythmia is a medical term that refers to a heart rate that is outside the normal range. An arrhythmia that is too slow is called a bradyarrhythmia or bradycardia.
The two most common causes of bradycardia are sick sinus syndrome and heart block. In sick sinus syndrome, the natural pacemaker unable to maintain your heart rate, whereas in heart block, the electrical impulses are delayed or stopped before reaching the bottom part of the heart. Once you eliminate the treatable causes of bradycardia, most of these patients will require a permanent pacemaker.
A pacemaker is a device that sends small electrical impulses to the heart muscle to maintain a suitable heart rate or to stimulate the lower chambers of the heart. There are over 3 million people worldwide with pacemakers, and each year more than 600,000 pacemakers are implanted.
The pacemakers have improved a lot in the past few decades. There's significant improvement in the pacemaker technology, the size, and the battery longevity. The major drawback of the current pacemakers is that patients cannot undergo MRI scanning. The MRI safe pacemaker will be released soon this year. And another improvement is the Wi-Fi technology where we can monitor patients remotely.
Almost all pacemakers are implanted to treat slow heart beating, which results in the brain and body not getting enough blood flow, and a variety of symptoms can occur.
The most common symptoms of slow beating heart are fatigue, tiredness, dizziness or lightheadedness. Sometimes you may experience a fainting or a near fainting episode. A shortness of breath on exertion is also one of the common symptoms. Rarely you may experience palpitations or confusion.
The pacemaker system includes the pacemaker itself and wires that connect the pacemaker to the heart. The pacemaker unit is slightly larger than a man's wristwatch and contains a battery and computer circuits. The computer circuits perform the functions of monitoring the patient's underlying heart rhythm and delivering an electrical signal to cause the heart to beat at the desired rate.
There are two types of pacemakers, a single chamber and a dual chamber. In a single chamber pacemaker, you have one pacemaker wire inserted in your heart, whereas in dual chamber, you have two wires, one in the top chamber, the atrium, and one in the bottom chamber, the ventricle. In dual chamber, the pacemaker coordinates the electrical signals between the two chambers.
At the Ohio Heart Institute in Youngstown, Ohio, Dr. Shakri Yarlagadda is among a group of cardiologists with 85 years of combined experience in pacemaker implantation and have participated in several pacemaker trials.
My first implant was in 1980. And we use cutting-edge technology. Some of our telemetry is wireless. You can be in California and have your pacemaker checked. You can be in Egypt and have it checked. We have our own dedicated pacemaker staff, and we participate in major trials for pacemakers.
The pacemaker is implanted by a minor surgical procedure performed under local anesthesia. The wires are placed through a blood vessel beneath the collarbone and positioned in the heart under X-ray. The wires are then connected to the pacemaker, which is placed beneath the skin just below the collarbone. The surgery usually takes about 1 to 2 hours, and the risk of surgical complications is about 1 to 2%. Usually only a small bump in the skin is seen over the place where the pacemaker has been implanted.
After pacemaker implantation, you may experience minor discomfort at the pacemaker site, and you will be kept in the hospital for one-night observation. After discharge, you will avoid any extreme activities for a few weeks. Routinely, you will see your physician in 1 or 2 weeks for the follow-up visit.
Prior to having my pacemaker, I was dizzy, listless, not wanting to do any of my chores around the house. But after I got my pacemaker, the dizziness had subsided, and I was able to do my work and do all the things outside of the house that I'm accustomed to doing as well.
Basically, for the last year and a half, I've been very fatigued and tired. I had trouble sleeping at night, and they finally put a looper in my chest, and they found out that my heart was slowing down to 35 beats, and my heart was stopping. I'd seen Dr. Yarlagadda's office, and he put a pacemaker in, and basically I feel more energy and pep. It's the best thing that I've done.
The most recent advancement in technology is allowing even pacemakers to go wireless. In fact, Dr. Yarlagadda has implanted several Wi-Fi pacemakers since September of 2009.
The Wi-Fi or the wireless technology that provides the remote monitoring of the patient's pacemaker. The patient's pacemaker information will be transmitted through a secure network to the doctor's office on a daily basis. The two major advantages are the patient comfort, so that patient don't have to go to the doctor's office or the hospital for routine checkups. And the second major advantage is the detection of any pacemaker malfunction or patient's rhythm disturbances.
Recovery from the procedure is minimal, and most patients return to normal activities within a few days after the pacemaker is implanted. It should be evaluated by your cardiologist every 3 to 6 months with the use of a computer that will provide information about how the pacemaker is working and about the life of the battery.
Some of the misconceptions about pacemakers are the safety with microwaves and the cellular telephones. The newer generation, the pacemakers are safe with microwaves and cellular telephones. And patients also can safely travel, and they can use the CB radios.
With pacemaker implants, patients should continue to follow a heart-healthy lifestyle that includes exercise, diet, and cardiac medications when prescribed. To learn more, visit OhioHeartInstitute.com or call 330-747-6446.